Hi everybody, in this video I will be dealing with the disorders of the endocrine glands. As I proceed with each disorder, I will be highlighting two aspects, one the cause and two the characteristics. The first disorder is acromegaly. Cause of acromegaly. It is caused due to the hypersecretion of growth hormones from the anterior pituitary gland in adulthood. This should be specified. Which stage of his life? In adulthood. So, what is acromegaly? It's a condition where there is hypersecretion of growth hormones from the anterior pituitary gland in adulthood. Somewhere even it can extend to middle age. This is different from a giant. Giant has a person who is a giant, there can be the same condition, that is hypersecretion of growth hormones from childhood. But in the case of acromegaly, it is hypersecretion of growth hormones from the anterior pituitary in adulthood. That's one difference. Again, an acromegaly person, a person who is acromegalic and a person who is a giant, we can easily distinguish. A giant, both are tall statured, but the difference is that an acromegalic, there is this disappropriation of the body parts. It is not appropriate. You can see the chest abdomen is normal, whereas the limbs, that is the hands and legs, are abnormally long, the jaw bones are abnormally long, the nose is broad and long, the fingers are abnormally long compared to the region of the chest and abdomen. Whereas a giant, everything is appropriate but lengthy. Even this region is also lengthy along with the extensions, that is the limbs. So, you can easily distinguish between an acromegalic person as well as a giant. Both are caused due to excess secretion of growth hormones. But remember, in acromegaly is excess of secretion in adulthood. Even it can extend in the middle age. Whereas gigantism is due to the excess of secretion of growth hormones in childhood. So, you can spot out a person in childhood itself that he is going to turn out to be a giant. He will be abnormally tall and this proportion of the body parts. Now, as I told you, the characteristics of acromegaly, one, his hands and legs are abnormally long, along with that the digits, mainly the fingers and the toes are also long. Not only that, you can see even the facial bones are also abnormally long. You can see especially the lower jaw becomes lengthy, and because it becomes too lengthy and disappropriate, the alignment of the teeth, there is some wrong alignment, therefore there is gaps between the teeth. So, it is easy to distinguish a giant from an acromegalic patient. Okay. The cause is the same, but the timing of the release of excess of growth hormones is different. In giant, right from childhood there is excess of secretion of growth hormone, whereas in acromegaly in adulthood. Clear? So, once again I am winding up with acromegaly, which is there in your syllabus. It is the cause is the hypersecretion of growth hormones from the anterior pituitary gland in adulthood, and the characteristics are enlarged hands, legs, feet, fingers, etc., and also enlarged facial features. The next disease is connected with the thyroid glands. The cause, deficiency of dietary iodine resulting in hypothyroidism. So, here I have to mention the role of iodine. Iodine should be obtained from outside. It is got through our diet. Iodine is rich in seafoods as well as in salt. So, once we take this through our diet, it will help the thyroid glands, which is located in the throat region, to secrete its hormones, namely T3, T4 and TCT. So, the iodine plays a very significant role in the synthesis and secretion of these hormones from the thyroid gland. But what happens if iodine is lacking in our diet? If iodine is lacking in our diet, this functioning of the thyroid gland is hindered. As a result, the secretion of these hormones will be very less. That condition is known as hypothyroidism. It is not directly by the thyroid gland, it is due to the dietary iodine. That is why it is advised to have seafoods. It is always good to have seafoods in your diet. If at all you are a vegetarian, you can have iodized salt. Now, you have noticed this particular disease is very common in the Himalayan regions like Kashmir, Himachal Pradesh, Uttarakhand, etc., because the people do not have access to seafoods. And also if they are vegetarians, the soil does not have much iodine content. So in that case, they can substitute it with some iodized substances, capsules, or in the case of salt, there are now iodized salts available in the market. Now the characteristics are enlarged thyroid glands. So it's very protruded, the gland becomes very prominent and protruded. Then in women, in adult women, what happens is menstrual cycle becomes irregular. Irregular in the sense is it does not have the same pace. If it is a 30-day cycle, sometimes it comes on the 18 days, sometimes it extends to 40, 50 days. So it's an irregular periods. So once again the characteristics, enlarged thyroid glands, and second, in women the menstruation or the menstrual cycle becomes irregular. Again the next disorder, the Graves' disease, again related with the thyroid gland, but this is in goiter it was hypothyroidism, but here it is hyperthyroidism, just the opposite, increased secretion of the thyroid hormones, namely T3, T4 and TCT, just the opposite. But in both the cases, this throat region or the thyroid glands get enlarged, both the cases. In addition to that, the person who is having Graves' disease have protrusion of eyeballs. Look at the eyeballs being protruded. Even normal, when he focus at us normally also, the eyeball seems like he is purposely projecting it out. It just pushes out. So protrusion of eyeballs, increased basal metabolism rate, and lastly unexplained weight loss, not because of dieting, not because of exercising, simply at all he will be losing a lot of weight. So that's all about Graves' disease. That is also related to the thyroid gland, but it's hyperthyroidism. Next, diabetes insipidus. Diabetes insipidus is caused due to the hyposecretion of ADH from the posterior pituitary gland. We know the role of ADH in the chapter excretory system. If I am drawing the figure of the nephron roughly, this is the Bowman's capsule and these are the other segments of the renal tubule. We know this is PCT, Henle's loop, DCT, and this is the collecting duct. We know reabsorption of water takes place in all the segments of the renal tubule. Reabsorption of water takes place here, reabsorption of water takes place here, the ascending limb, descending limb, the DCT, and in the collecting duct. Water is reabsorbed from the filtrate, and finally the urine that is excreted will have only less water. And definitely it should have water because urea is present, it should be lost with water, but the amount of water lost is less. But what happens if ADH, and which is the hormone that is helping the reabsorption of water, we have learnt is ADH, but what happens if ADH is lacking? If ADH is not present, will this reabsorption take place? The reabsorption of water does not take place from the filtrate. As a result, a lot of water is lost. Lots of water is lost, resulting in a condition called diuresis. We know ADH plays an important role for the reabsorption of water from the filtrate, but if ADH is not available, what happens is no reabsorption of water. All the water travels through the different parts of the renal tubule and is lost out in the form of urine. Definitely, water loss through the urine. Then what happens when this loss of water through the urine? Dehydration. Our tissues gets dehydrated and we have the sensation of being thirsty, and we quench our thirst by drinking a lot of water. No point, we are urinating. Continuously the cycle continues. Drinking water, urinating, drinking water, urinating. So untold or unexplained thirst. Then the person goes to the doctor, get himself diagnosed, and he finds that he is having hyposecretion of ADH. So this disease is called diabetes insipidus. It cannot be interchanged with the next diabetes, which I am going to take in the next slide. So diabetes insipidus is due to the less secretion of ADH from the posterior pituitary gland. Next is the diabetes which I was telling you, the diabetes which is common among your grandparents, that is high blood sugar. That is diabetes mellitus. The cause is hyposecretion of insulin from the pancreas. We know pancreas secrete the hormone insulin, which is very, very important, which converts that brings down the glucose level. We know that glucose present in our blood should get converted into glycogen, and this process is called glycogenesis, genesis of glycogenesis. But in these diabetic patients, this conversion does not take place. Glycogenesis does not take place, which means this glycogen is not formed, and therefore the bloodstream contains a lot of glucose. See, we have shown the picture with lots of glucose in the bloodstream. It is not also, not only it's not converted into glycogen, it's not been absorbed back. So what happens is the blood contains a lot of glucose, and also a lot of glucose is lost through the urine. These are the two main characteristics of diabetes. There are other characters too, like wounds take time to heal, then excess thirst, etc. You know from your grandparents what they report about the common symptoms. But the two symptoms mentioned in our text is just blood glucose level. The glucose level in the blood is high, and a lot of glucose is lost in the urine. So that is what is called diabetes mellitus. In normal persons, glycogenesis is taking place, but in these people, this particular process is itself not taking place. So what happens? Glucose remains in the blood. Clear? We are having the last disease, Addison's disease. It is due to the hyposecretion of the adrenocorticoids. We know the adrenal cortex secretes three corticoids: mineralocorticoids, glucocorticoids, and gonadocorticoids. This is mainly due to the glucocorticoids. So Addison's disease is due to the hyposecretion of the glucocorticoids, and the characteristics are: it alters the carbohydrate metabolism of the person. The person experiences acute weakness, fatigue, and not only fatigue, nausea, vomiting, always tendency to vomit. That tendency is known as nausea, vomiting, constipation, and abdominal pain. So untold, very mysterious. He'll always doubt that what he ate, there's some indigestion. But finally, when he gets diagnosed, this is found that the amount of glucocorticoids is less. So once again, the characteristics mainly that are highlighted, which you have to study, is just what is projected: alters the carbohydrate metabolism, acute weakness, fatigue, etc. With that, I come to the end of this topic, endocrine disorders. There are more endocrine disorders, but only these 7 endocrine disorders are mentioned in our text. Thank you.